Hello, everyone. Thank you so much for joining us at the Voices podcast. My name is Arafat. Today we have a very special voice. Today we have a doctor in our studio. We have Dr. Ian. Another name is
Shyaka.
Dr. Ian Shyaka. I'm sorry. But today, Dr. Ian joins us to discuss on plastic surgery and cosmetic surgery. He's an expert in those two fields, and he's doing a lot of work to ensure that plastic surgery is known in the country, and most people get to do it. So, Dr. Ian, thank you so much for joining us today on the podcast.
Thank you so much, Arafat, for the invitation and the nice introduction. It's great meeting you here.
Yeah, sure. Seriously, many people are interested in knowing about plastic surgery. Usually, when we hear plastic surgery, most people think about cosmetic surgery.
Yeah, that's true.
And to me, I found it very challenging. I remember when I was texting you, were like, hey, you asking more questions of cosmetic and not in particular plastic as a whole. So I wonder, can you walk us through into a full scope in a broader way? What exactly do plastic surgeons do?
Okay, so plastic surgery, just like you've said, when everyone hears of plastic surgery, they think of what you see on social media, what you see on Instagram. We think of cosmetic, we think of butts, we think of breasts, we think of facelifts. But actually, that's a very small part of plastic surgery. As plastic surgeons, there's something called reconstructive surgery, and then there's cosmetic surgery, and all that is part of plastic surgery. So the reconstructive surgery, which is actually the biggest part of what we do actually world over, unless someone just chooses to do only cosmetic, it involves things like, when someone gets an accident and they have a wound, or they have a wound, there's like a bone which is exposed, and we are the plastic surgeons who have to come in and do the reconstructive part to cover that bone, for example. We have to take like some tissue from one part to that part that is damaged, so that the patient can recover. So things like burns, we are the ones who manage people who get burn injuries. So most of those wounds, that is all reconstructive surgery, including people who are born with conditions. And normally it's like, I don't know if you know about clefts, like people who, they have a slit, like the lip is not complete. Yeah, so all that, or you have fingers which are fused, or you have extra fingers, or you have so many things. And that is the broader part of reconstructive surgery. And then there is also the other bit, which is cosmetic surgery, which is mainly to improve appearance, or to restore as we age. Like, for example, when we age, we undergo changes with our face.
I see many people are like, I'm getting to, my face is too old. I need to change my face and make it look nice.
Yeah, it's actually not possible to entirely reverse time, but we can call it to rejuvenate. Like, you try to overcome some changes which come with ages. If someone has wrinkles, someone has saggy skin, because when we age we lose a lot of fat. It's in the skin, in the face, and then we can do something cosmetically to look a little bit younger. Or if you gain weight and you have a big tummy, we can reduce the tummy.
We will go to that later. But you talked about burn, accidents. Are those all under the plastic surgery department?
Yeah,
like, if someone gets a burn and needs the place to be covered, how is that part of your work?
Yeah, that's our work. That's correct. That's our work.
So how does reconstructive surgery really? What does it entails in a broader way? What is it like? You only replace the how do you call it?
So we basically try to return function. We try to, because when you get an accident or when you get a burn, there's some function that you lose. If you get an accident and you have a very big one, you're likely to to lose function if you lose that limb, that leg, for example. So we have to come and cover that before you get like infection, or if there's no plastic surgeon, sometimes you end up with amputations. You lose the limb. So that is
Where did your interest to join plastic surgery start from? Where did it come from?
So my interest to join plastic surgery actually started a little bit later in my career. I initially wanted to be a cardiothoracic.
Oh.
So cardiothoracic surgeon to operate the heart, and because I wasn't exposed to plastic surgery that much. Plastic surgery is quite new wherever in this region. But then during my time I had my surgical training. So I worked with a plastic surgeon. I saw what they were doing. It was quite fascinating. I liked how the outcome, how you would fix the problem, or the patient goes back to work, and there are not so many in the country as well. So
Currently, how many are we in the country?
Currently, we're six now. We're six now. So
okay, six in the country.
Yeah, six in the country, and I think it was only one person until 2017. Now we're six. So the trajectory is better.
Okay. So, what are some of the most impactful reconstructive surgeries have you performed in your career so far that you can say, look, Arafat, I know this guy, I know this lady, I performed A, B, C, D, and I felt proud of myself that really done a great job for this person?
I think most of the surgeries that I've performed, and I really feel like it's gratifying, is when you save a limb, when you save someone from a leg loss, for example. You've had an accident, and the only way this could be saved is if you reconstruct it with plastic surgery, and then the patient
So are you trying to mean, like, let's say someone, the bone is exposed out. He had accident and the bone is exposed. So without plastic surgery, you can't cover up the bone.
No.
Then the end goal is to amputate it.
Yeah.
So if you come in and cover that,
so
you're restoring his leg.
Yes. So you save him from losing that leg. It could be a leg, it could be a hand. Also, sometimes, like people who have injuries to the hand, you find has been cut by something and there's no blood flow to this hand. So it is our role to come and establish blood flow so that you save that hand. If there's no plastic surgery.
How do you do that? I mean, so you said that maybe the hand has been cut.
Yes.
In two?
Yes, almost. It can be completely or almost completely.
I mean, can the hand cut completely be
Yes, that's what we do.
Really? Let's say this part is here and this one is here.
Yes.
Cut in two pieces.
Yes. Of course, we work with the other team, like the bone surgeons, to fix the bone. But we, the ones who are going to establish and make sure there's going to be flow of blood back to that part that has been.
Have you done that before?
Yes.
Where? In Kigali?
Yeah, yes. Not fully cut. No. But sometimes the blood vessels are cut. So meaning, even if it's not fully cut, there's no blood. There's no blood flow to the hand.
I get it.
So either way, you would have to finish to complete the amputation. But when you repair the blood vessels that have been damaged, then you restore the hand.
So plastic surgeons are the ones who repair the vessels,
the small blood vessels,
the nerves.
Yeah, and also.
And you align them to where they were before, and then you make blood flow.
Yeah, again, reestablish blood flow, and then the hand is able to live.
Wow, so you do a great job. I did seriously myself. I didn't know much about plastic surgery, but now I didn't know that's how it works.
Yeah,
that's wonderful. So how does plastic surgery intersect with trauma cases?
So like this, I've been talking is really trauma.
Oh, it's trauma.
Yeah, it's trauma. When we talk of trauma, we're talking about physical trauma. So
physical trauma, that's accidents, motorcycle accidents, motor bands.
Yeah, or even these occupation injuries. People working in industries and they entangled into various injuries. So
are there sometimes or while doing your work where you face challenges that hinders you to perform the way you're supposed to perform? Or is there a patient that comes up and then you find that like you want to do something to that patient, but the patient feels like, no, you can't do this to me, or maybe this is not the right way to do it, or maybe there's some ethical challenges that stops you from doing what you're supposed to do.
So sometimes patients have different beliefs. So like we are talking about burn injuries. So someone there will be a rumor that if they put skin, because when how we treat like burn, we get skin from some other place and put it to a wound.
Okay.
So some patients will be like, no, this one is going to make the condition worse. So sometimes patients do not receive that fast.
Talk about that. So you can get a skin from, you said, from other places.
Yes.
Where do you get the skin, by the way? Talk about that.
Yeah, so we get a skin from another place of the same person. Like if you have a burn of the face, for example, so we can use the skin from the thigh. We get a small piece of skin, and then we put it on the face. So the face will heal very fast because of the skin we put. And when we got the skin, because we've taken a very small part of skin, it will heal by itself. So you heal very where you get the skin and where you put it, everything heals very fast. And
so some people feels like, no, you can't remove my skin from here and then put here.
There'll be rumors. Like say, patient will say, I heard of someone when they did plastic surgery, and so they will not accept it so quickly.
So what do you think makes people, I mean, because by virtue of look, it seems like the community does not really understand the role of a plastic surgeon mostly. And currently, what are you doing, or what do you think should be done to create awareness in societies that plastic surgeons are also very key and important in the societies? Because, you do a lot of work. It seems you do a lot of work, and most people don't know about what you do. So is there something that is lacking to ensure that at least you're also highly valued,
I think actually our work is really,
because even you can see even young people are not taking up the course. If you're only 6, sincerely speaking, why?
Because to train, you need also the number of trainers and trainees. They need to really be proportionately distributed. So before they were, say only two can train, only 3. So now we are 6. So we get to train more. So like now they're about like 15 more in training.
15 more in training.
So I think in very few years, maybe 5 years, will be more than 20 plastic surgeons in the country.
So many people are interested to know about cosmetic surgery.
Yes.
What is cosmetic surgery?
So cosmetic surgery is the other part of plastic that is not to do with functional. So that is someone, like I've said, when someone has, let's say you age and you want to use a few signs of aging, and that's okay. Let's say you have excess skin on the face, you have wrinkles, you have bald.
Bald head?
Yes, that is.
Are you working on that too?
Not yet, but not doing transplant. But there are other ways we are treating that.
Doctor, let's talk about that way. How are you treating? Like, let's say I have that bald head, and I feel like, I'm not happy about it.
Yeah.
I want it to be worked on and have my hair back. Are you doing it? Which kind of way were you talking about that you're doing it?
Yeah, so there is hair transplant, which is you get hair from where there's still part of hair, like especially the back, and then you plant it where it went off. So that is hair transplant. So that
when
one
you plant
it
keeps growing?
It stays there because you're getting it from a place which is, when you are balding, there are some places on the head that don't usually undergo balding, especially the sides and here. So when you take hair from either the sides or from here the back, keeps behaving like where you got it from. So you're not going to lose it.
Doctor, don't take it for granted. We
Yes.
need you to educate us about that. Seriously, let's say,
But other than transplant, there are also other ways. Like there's medicine that people use.
so
Can
is
be
that
used.
transplant being done in Rwanda?
Not yet.
Not yet.
Not yet.
Where you get hair from here
Yeah.
and then put it
Yes.
here and then keep it there. So when he goes to the barber, he just cuts a small
No,
on
it's
top.
no hair. It's normal. You
You
behave
can
like-
cut it and then
Yes, it will come, 'cause
it will come again.
because it's not like what you call, it's not like a wig. It is planted into the skin.
No, I was wondering. It's like I was like you create a wig
No, no, no,
on this side
No.
of a bad head, and then at the end of it,
no,
it keeps cutting the top
no,
and
no,
then
no,
leaves
no.
it there.
You plant it like how you plant grass. Actually. It's not something complicated. You just uproot it from where you're getting it from, and then just with a small hole, plant it into where you want it. So there's not much.
And naturally comes.
And then
comes it keeps growing
to
naturally.
establish and become natural hair.
Oh wow, that's wonderful. So which other way were you talking about?
There is medicine that we use, medicine and some sort of injection that we do. So all those we are doing that in Rwanda.
So
What you're not
today,
yet doing
today
is
what you're doing
transplant.
on people with buried heads is medicine, is a treatment with
other
medicine.
non-surgical ways.
Now, okay, you're doing non-surgical ways,
Yes.
which is giving drugs
Yeah, drugs and
and
there are some medicine we inject which stimulate the hair to come back and stop the falling out.
okay.
Yeah.
Have you had some success?
Yes, there's a lot of success.
You have some people that have really regained their hair
Yes.
in Rwanda. Wow, wonderful. I'm going to send you some clients. So, okay. Let's go to the butt lifting and breast reshaping and I don't know how they call it, lifting and all that. So what are some of the dangers before you go further? What are some of the dangers that these people you tell them before you do the reconstruction, before you do the before you do the cosmetic,
yeah.
and before you go on for the surgery that they should be aware of as they go into this? For instance, the buried people with buried heads. I don't know if there are some side effects you can share with us for someone who is going to do that to be aware, because I don't believe they're not
Yes.
there.
Yes, every surgery actually has a potential side effects. Let it be cosmetic, let it be reconstructive, let it be anything. The moment you're going to do surgery on someone, there are always known potential risks that we always elaborate to our clients that come. For example, if you're going to do like the butt lift, you're asking me about. So basically, if a butt lift, I don't know if you people don't understand what it is. I mean the Brazilian butt lift. So basically, it's getting fat.
Why was it called Brazilian butt lift?
I think it's really the origin, maybe.
It's originated from Brazil, eh?
Yeah, I think so. Actually, that's a good question. So what we do basically, it is increasing the size of the butt using someone's own fat.
Someone whose own fat.
Yeah, let's say fat is one of the ways actually. So
I was wondering, you're talking about the Brazilian butt lifting. I asked you why they call it Brazilian, but it seems
it's originated from Brazil. So it's a Brazilian surgeon. It's called Pitica, I think. He's a surgeon who invented this process of getting fat from the abdomen to the butt to increase in size.
Give us a full detail of how that surgery is done. Seriously, let's say maybe you've not performed it in Kigali. Have you already performed it here?
Yeah.
How many have you performed in Kigali?
No,
now?
not really, not Brazilian as such, but sometimes you find someone has like a small depression on the buttocks. So there you can put fat, but not really like with a big BBL. No, because that is not something that we are performing that much around here.
But you're performing, I mean, you're shaping someone and I mean, giving them a nice figure.
Yes.
I mean, Is that how you call it?
Yeah, a figure, a nice figure, or a figure they desire, but it has to be realistic also.
It can't be the BB one.
No, some people come with pictures from Instagram and say we want.
I want this.
This. So most times we have to come to reality and discuss. For example, how much fat you have, how much can you accommodate. So you don't just. We don't do as.
Okay, doctor. If you've performed some here in Kigali, can you tell us the number, if you really recall some numbers? And can you tell us how it starts and how it ends, and the follow-up to the patient, how the follow-up is done? Let's say I come to you right now and I'm telling you that I want to lift my butt at least to a certain level, as you said, to a considerable one. And you've accepted, you say, oh, this we can do it depending on what you're performing now. How does the process start? What is the information that you give me prior the reconstruction? I mean, prior the cosmetic surgery, and after, what is it that goes up next? Do you do the follow-up? Which kind of treatment that is needed after? How long is the treatment needed?
So it is okay. So yeah, that's a quite extensive process, because first of all, when we actually don't like to call them patients because they are not sick. So when someone comes, you first understand what they desire. What do they want? Because sometimes someone may not know what they want. Someone comes with a picture like, I want to be like this person. So there you have to go through a process of educating the person and say, we don't change. We don't change people. Yes, we can do this, but we may not do this, or if we do this, it may not be. We look at a person as a whole. So if someone is, for example, very
thin,
and then you want something that is
extra large, and
so we have to make sure that's why you talked about ethical considerations. For example, in some countries, people get what they want. You say, I want you to change my bum like this, and people will do it, but I think there comes some ethical considerations, because you don't want to change someone into something else. Maybe they are not aware what they're going for, and we know, sometimes we know, actually all the time we know much more than that person knows. So it's our responsibility to educate them. And
so that is ethically known, that you cannot do an extra thing on someone.
No, usually even when we are training, we there's something that is approved, and we don't do every surgery that you want to do because you've thought of something, or because the patient wants something. You cannot just come and say, I want to twist my eyebrows like this. Some people ask for that. They say, I want cut eyes, I want that and this. So you have to educate the person and say, okay, maybe this may not be good for you in the long run, especially if it's to do with trends. People, there's what they call trend surgeries. There's a trend that's going on TikTok, on Instagram, and someone wants their eyes
that
to be
trend
like
to
this.
come like that. They call it. They call it. There's a fish. Is it fish eye? I've heard. I don't know which kind of a name they've given it. I've seen some girls nowadays. They are putting things here to pull.
So someone will come and say, "Do that for me," and it's our role to protect actually the public and say, no, this one may not be good for you, because this is if the trend surgery, the trends change. You cannot keep on changing people's shapes according to which trend has come up.
According to which trend that is up.
Yeah. So sometimes you asked about the process. So what we do with the process, we get fat. There's something called liposuction. It's a procedure called liposuction. So with liposuction, we're using a very small tube. It's called a cannula, but it's like a small tube, a few millimeters. So we put it into the abdomen. There's a lot of details that goes on.
So you cut the abdomen?
No, we don't cut. Just a small puncture, very small, less than 1 centimeter. You get fat. You put in the tube and do something. You do some surgery and get out the fat, and then prepare that fat, and then transfer it, process it, and then inject it wherever you want. It's not only in the buttocks. So BBL, or Brazilian butt lift, is one of the fat transfers. So mostly what we do, actually what I like to do, is to use the fat for the face. Most people, when you age, the face becomes very thin. You lose fat from the face. And then we get that fat and we put it in the face, and it really looks good. Also the hand. So the buttock is just one of those places that we can put that fat.
So you inject it on the face. If someone wants the face to be lifted, you get the fat and you inject. Let's say someone is very old, and wants the face to look more younger.
Yes.
What you do, you get that fat.
Because when you age, there's some fat you don't lose, like fat of the belly will stay there. But we lose the fat from the face, and that's why we look hollow and aged, and you see like your face, it's all full. But if I come back in 30 years to come, I'll be able to see this bone.
Wrinkles.
I'll be able to see this bone. I'll be able to see here there will be some hollowness. Here will be hollow, because the fat has gone with age. But I'll be able to find some fat on your tummy,
and then
you inject it.
You inject it directly on the parts of the face.
Yeah, we put it there where the initial fat was.
After preparing it.
Yeah, there's a process, of course. It's a little bit detailed.
So when you inject this, let's say on the butt, let's go back to the butt. You inject it on the butt. You inject all the parts that you want to lift. That's where you inject it. Or you inject the entire butt so that it comes as a whole?
It will be the whole butt. But sometimes the individual has different requirements. Like I've said, most of the patients I do are not for the whole butt. You find some people have depression. Like in childhood, some people, we used to get quinine. I think quinine was the medication which we use. So you find they get depressed, get a scar. You find there's a scar that looks like a dimple, but it is depressed. When someone puts on something, the depression is really visible outside. So that's the place you can put the fat, and then the butt will look uniform.
Will look uniform.
Yes, with using one's own fat. Sometimes in other places, not here, where we implants can be used. Implants. It's like an implant, which is, you've heard of implants?
Yes, I've heard of
implants, like what we put in the breast. Usually they're made of silicone, so you put it there. When someone doesn't have the fat, put the implant there, but it also has its own risks, because implant, unlike the fat, implant is not your own body.
I get it.
Yeah, so it's something introduced from outside.
So most people out here, I think they know much about the implant than the fat.
I think
because when you hear out here on the streets, when people are talking about butt lifting, breast lifting, they're saying, you know what, the things they put inside there, and sometimes they become old, and
most
they
people
create
don't
problems, and you find that someone is, I don't know, they use bad words. I don't want to say it here. That someone starts rotting. Can you talk about that? Is it true that the implants, when someone uses implants, in the long run, the butt can start rot?
No, not always. Not always.
Not always.
Not always, but there's a slight possibility that when you put an implant, there's a slight possibility that you can get, for example, an infection, because this is something foreign. So the body can also attack it, can react to it like it is a foreign body into the body. So the body can form something around it and attack it like a foreign material, and then it will need to come out. Or if you get an infection, but it's not really rotting. I think most people use a little bit of very tough language.
Seriously.
Yeah, and it can happen with any surgery, especially if you get infection. Infection it's a known risk for any sort of surgery. Let it be butt, let it be breast, let it even be reconstructive, let it be gynecology, let it be any sort of surgery you can think of, even if it's circumcision.
Sure.
Infection is always a known risk whenever you have surgery. But of course, for cosmetic, because this is someone who wasn't really sick, so when you get such a complication, it's not really well related. Yeah, but we always educate them prior to doing any surgery. Yeah.
For the surgeries you've performed in Rwanda, the ones you've performed plus, cosmetic surgeries, how do you do the follow-up? I mean, because I'm not sure. You need to tell me about. You need to tell me about this. When you use the fat, what are the risks after?
So, So risks. There can be some risks in the operation itself, like this BBL. There's a slight risk that if that fat goes into the blood vessel during the process, the patient can actually die.
What do you mean? If
Yeah, because you're injecting the fat in the breast, in the buttocks.
blindly, you don't you inject without knowing exactly where you're injecting.
We don't do surgery. So you put something like a syringe and put the fat, but we know the anatomy. We know where the blood vessels are. We know where not to go.
That's what I was saying.
Yes, we know where not to go.
So you mean accidents can happen?
I'm just saying this is something that is known the world over in plastic surgery, that there's a slight risk that if the fat goes to the blood vessel, then you can have you can lose a patient's life. It's not so common. It's a very, very small risk, but it is very significant. You get it. So it can be very terrible. But
Like out of 10, we have one.
no. Maybe out of 100,000.
Okay.
It is a very small risk, but
It's
it's
a
a,
very
known risk. That's what I'm
Okay.
saying. So when we're explaining to patients before these surgeries, we don't only say the common risks, even the very slightest. Because if it is one person in 100,000, we don't know who that one person is.
It might be you.
Yes, so
Yeah,
we
sure.
always say that. And then also, if you get infection, then you can lose the fat. If the fat gets infected, you can lose that fat. Or sometimes
So you mean if you get infections,
infection, yeah, sometimes
so the fats that have been injected to you
can die.
can die, and then you'll go back to where it used to be.
Yeah, most likely. Of course, you need to manage the infection, but you lose the fat. Then also, if you, for example, fat may, we call it take, meaning what you put in doesn't stay there. Like 60% is what is going to stay in your body. Some the body absorbs and dies off. So sometimes on one side 70 may take, and maybe 65. And maybe you have a little bit of size discrepancy, but that can be dealt with and do another top up. So that's not a big problem.
So the first surgery, you can get 60% of what you expected,
Yeah.
and then later, if you feel like it's not what you wanted, you can do a lift up. You can do a top up. You call it a top
Yeah.
up.
I would say you can top it up. So
Jesus,
Yeah,
it's
but yeah, I don't know why we are really focusing on the
No.
BBL, because this is not the commonest. We do.
no. Now that's where I was heading to. I want us to look at what is the commonest that you perform now here in Rwanda.
So I think the commonest is breast reduction and tummy tuck. I will talk about breast reduction mainly because it is not entirely cosmetic. It affects the life, the quality of life for most of these people that we do the breast reduction. Because when a lady has big breasts, they will have chronic back pain from the weight of the breast. It will be very hard to find the right size of the bra to put on. Sometimes they are not able to go into the gym and do sports because it's not comfortable. It's not comfortable. Some people will say, I don't feel.
But seriously,
okay going to-
humans, we are human.
going-
Imagine in Europe and these other parts of the world, women are looking for such breasts that we're talking about right now. They're called extra. I don't know what they call it. Big breasts.
Yeah, most of those are trends actually, and most of in African population we tend to have bigger breast. So we tend to want to reduce that because it's giving us symptoms. So it's not really cosmetic. You can imagine someone who has very big breasts and cannot find a suitable bra. Someone cannot do sports. Someone has chronic back pain from that. So when you're able to do surgery, and actually, since sometimes it happens in adolescent stage, you find the adolescent, or if I may say, the girl is affected in school. Like they have some sort of stigma. You find they're trying to hide their breast. They start to bend like their shoulders. They will be trying to mask and end up with bad postures. So sometimes when we do breast reductions for those patients, it's really rewarding. Actually, it's one of the most appreciated cosmetic surgery world over, breast reduction. About 95% plus of patients who get breast reductions are really happy that they did it.
How do you do that? Because I don't really understand. How do you do that?
I need to take you to.
You need to take me to the lab.
I won't take you.
I mean, so someone comes and says, you know what, I want my breasts to be reduced.
Yeah.
To a small level. How do you do? I mean, the procedure is also you cut and repair and.
Yeah, you have to cut.
Oh, you remove parts.
Remove some part of the breast itself, not only fat, and leave only the desired or an appropriate size for that person.
So how you after cutting it, you do the real cosmetic of covering it and making it.
The whole thing is the cosmetic, because you don't just cut. So we know from the start what we are going to take out and what you are going to stay with and how it's going to look after. So it's a little bit of art.
There's a lot of art.
There's a lot of art
and measurements. Before you go into it, you must have the measurements, the size you want, and
actually most of the surgery is in the measurement. If you've not measured, then you cannot do the surgery. You have to measure and design and everything. So our patient will be having markers and all that before we go into theater, and then we do the surgery part.
So breast reduction is what you do mostly in Rwanda?
Yeah, and tummy tuck.
So talk about tummy tuck.
So tummy tuck is like when ladies, for example, also men do it, but mostly is ladies when they give birth. When you give birth and they're not able to lose the belly fat, the belly fat, and also the skin is a little bit loose. So, because for tummy tuck you need loose skin and you also have extra fat. So we do the liposuction, liposuction meaning we take out fat. And then after taking out fat, we also deal with the loose skin. We cut the loose skin. So we reduce the loose skin so that someone has a close to flat tummy. Sometimes you're not able to achieve that.
You don't achieve 100%?
Yeah, but the person will have
at least 60%.
Yeah. And sometimes when women get pregnant, the muscles of the tummy, somehow they tend to separate a little bit. And after delivery, the muscles don't go back to the original state. So we have to go in and put back those muscles.
You've talked about after delivery, and this has brought me to this. Do mothers that have had also C-section can go through the same thing?
Sure.
Because these are the ones
easier
mostly
for us.
suffering from the tummy tucks and all that.
No. It doesn't have to do with C-section. There's no connection. Even normal deliveries, tummy tuck is
common.
It's common. So
okay.
So cesarean section, it's not any different. We just use the same scar that they have already.
Or you use the same scar?
Yeah, just a little bit. Extend it a little bit.
You extend it a little bit and then you cut both sides. Jesus Christ. So on men, how have you reduced some men's belly?
Yes. Men.
Here in Kigali?
Yes, men, they do it a lot.
Men, they do it a lot?
Yeah.
This is serious.
Not as much as women, of course. Yeah, but they do it a lot. But for men, maybe something I should talk about for men is what they do. Men is the man boobs. I don't know if you, it's called gynecomastia in terminology, but man boobs.
Gynecomastia.
Like boobs.
Uh-huh.
Like you're a man, but you have boobs. I'm sure you know what that
I
means.
know.
Yeah, so that is plastic surgery as well. That's the commonest that men will seek for. Because you find someone has boobs and they're men,
The men,
so they're not comfortable to take out
they
their
can never be
shirts. They're
comfortable.
not cannot go to a swimming pool. They always have to find something to hide that structure.
About the berry reduction, because I've heard that some men who are going for berry reduction, there's this trend of every man is looking for something that can take away their berries. But I've heard some men are going for surgeries, for cosmetic surgery to have their berries reduced. I think
I
due
don't
to
know if
that,
you're talking about what I just described, or if you're talking about reducing the belly or reducing the stomach.
reducing the stomach.
So sometimes when they say reducing the stomach, they're not talking about this fat.
Uh-huh.
So there are other surgeries which is not done by plastic surgery,
Okay.
where it's called bariatric surgery. So it's more, the size of the stomach is reduced. So you don't eat, you get full very fast. You'll not get hungry that
what they do.
often. But they reduce the stomach size, and that's not plastic surgery. So
I know that
for
that's
us,
not
what
plastic, but I mean, there's some men who have big berries,
yes,
and they want their berries to be small.
yeah, that's what we do. Of course, that's the liposuction. It's not different from the females. It's the same.
It's the same.
It's the same.
So you remove
But
fats.
it is not a weight loss procedure. We don't do weight loss procedures.
That's what I was coming
Yes.
to. I was coming to ask you that, are you doing now the weight loss procedures?
No. Because most people think that reducing this surgery we do of reducing tummy, reducing this and this is weight loss. So it's body contouring. So it's cosmetic. You cannot use, it's not a way to lose weight. Maybe if we can do that, sometimes someone will say, if you take away this
Very fat.
this belly, if you reduce my breast, I'll do a lot of exercises and I'll be going to the gym more. I'm more comfortable, for example, after reducing the breast for ladies. So we can do that, but that is not.
But doctor, sincerely speaking, after doing the berry reduction and all this that you've just talked about, can I still go and do the gym like I used to do and then get the
Even
6
more.
packs?
Even much more.
Really?
Even much more. Yeah, even much more. We can actually create 6 packs in surgery. Yeah, we can give you 6 packs in surgery. It's another way of, it's another cosmetic surgery.
You can give 6 packs in surgery.
Yes, we can with liposuction.
But those are cosmetic 6 pack.
Yes,
When you touch them, you will
it
feel
be
like
soft.
it'll be soft. So funny.
It will be soft.
But when you remove the shirt on the beach, everyone will see that. What the guy has 6
or
packs.
even put on the shirt, someone you can see the markings.
inside.
Yeah, so it'll be 6 packs.
And then someone you'll feel have 6 packs. But they will not allow it to come closer because when you touch, they will say, no, this is not true. You are just wearing a soft body, that's it.
But yes, after liposuction, you can do gym. Let's say after 45 days, that's about after 6 weeks. You're back to normal. So you do gym as much as you can, your body can handle. And
I have this question that really want to ask you. Does really plastic surgery or cosmetic surgery makes people happy, or to some, like in the future, it makes them more bitter and more unhappy about their life? Or does it create depression or anxiety in the future?
I don't think so. I wouldn't want to really speculate that much. But I think if I'm battling with it's a big boobs as a man, and I'm not able to enjoy my life fully, and you take away that, and I am able to enjoy my life, I feel like that is some sort of contribution to happiness. If a lady with big breasts is not able to do exercises and is feeling doesn't feel good about it, and they feel very good after, because they are always really very happy after seeing the results. I think that is, but doesn't solve sadness, because it depends on sometimes someone may come and there's something we find a lot in cosmetic practice. A person is not happy about anything. They say, you want to change this, but when you talk to them, you find out that actually the problem is not what they come for. So someone will say, I want small breasts, I want this, but when you talk to them, you find out that they actually have some mental issues going on. So if we are not able to identify that person and we go on and do surgery, you will never, you end up in endless requests. So you do that, and then they will come and say, there's a scar, I don't like this, I also want to reduce this. So you find they want to change everything, but in the actual problem is a mental problem. So sometimes we need the psychiatrist as well. When we identify such a person, we link them to psychiatrists or psychologists for more help, or better help.
I mean, sincerely speaking, I don't know even where to start from. What is the cost of all that? Because you've just mentioned that you receive quite a number of people coming for those services in the country. How costly is it here? Because we see so many people flying abroad to go and have these surgeries. I mean, they call it cheaper surgeries abroad. Maybe they don't have much trust about, our local doctors. How much does it take for me to have my belly reduced? If you can give me a full cost to a private.
I think I will not be able to give you any figure to that. But all I know, it is affordable by most people who want that. It's not, most of them are not covered by the insurances because it's cosmetic. But
that's what I wanted to ask. Is it really even before maybe after when you finish that? Can you talk about that, the insurance, which cosmetic or plastic surgeries that are covered by the insurance?
So the reconstruction, they're all covered.
The
reconstruction
yes,
ones,
okay,
everything, yes. The cancers, the burns, the people who are born with defects, the trauma, all that is covered. But cosmetic will not be covered by insurance. And this is not something about of Rwanda only, but internationally, cosmetic surgeries or most cosmetic procedures will not be covered by insurances.
So you can't estimate.
It's different because it would be different in different hospitals and different settings, but it's definitely cheaper than going abroad. And considering that here you'll be able to have weekly visits, it's easy to follow up, and you don't need to go somewhere and come back all the time. I think why people are doing that is this is a little bit something new. So people are not used to doing cosmetic surgeries in the country. But now that there are plastic surgeons, I think those travels are much less. Much less, because sometimes you see people who did the first procedure, it's in a certain country,
they
went to India.
To go look for that guy the same time you want to do maybe something else. So that's why some people you think they prefer here because they have access to the doctors easily.
Yes, easily, and it's affordable because this is where I trained. I trained in India for cosmetic surgery, and the prices are crazy. When you look at the prices here, it is really cheap. It is cheap. It is cheap. It's home. There's no flight tickets attached. If anything,
how do you see the trust?
It's coming up. Actually, the first problem was I think people were a little bit shy. People don't want to be known that they've done some sort of cosmetic surgery. That is why most people would fly out.
Go out.
Because I come back and no one knows what has happened. Like, what if I go to this hospital and then they see me But that stigma, I think, is now really low. People have embraced it. People have known that cosmetic surgery is part of it's normal. It's done everywhere. We just hadn't really embraced it, but it's being embraced.
It's being embraced. And you can see that people are coming freely, not feeling any fear.
okay.
Like, there's no stigma.
No.
Stigma has been reduced to
No.
how people come to see you.
No.
And you've talked about the cost that is now affordable in the country, but I really wanted you to give me the numbers. Do you have some numbers?
No, because usually for us as doctors, we are not directly involved in the finances. Otherwise, if you're the treating physician and you're the one setting the costs, and it becomes
so. How has it been evolving? Because let's say today you're saying you can do butt lifting, you can do breast reduction, you can do reconstruction. We've been doing it, and I think you're doing it. I mean, now it's advanced, and I want to look at where are you headed now. What are some of the new procedures that you want to bring on board that you see that are being performed everywhere in the world, and you feel like you have the skills for them, but you are not performing them, but you hope to perform them?
So maybe I'll go back to reconstruction, if you don't mind.
No problem.
Yeah, because reconstruction, especially, for example, people who have breast cancer, that is a very big something of concern. So we, as plastic surgeons, we are able to reconstruct a breast. Say a woman has had breast cancer and then they lose that breast, because breast cancer is one of the cancer that is curable if caught early. Sometimes that cure means losing your breast, but a woman's breast is something of dignity. So as a plastic surgeon, we are able to get tissues, to get like something from the belly, the whole tissue from the belly, and take it there and reconstruct the breast, and then
grow it.
Yeah, becomes like it's not really, we cannot bring back the breast, but we reconstruct the breast.
I mean,
something close to the breast, to the other side. So I feel like that is something that is very dignifying, and it is something that is needed, that we would be able to do, and we'll be doing very soon.
So soon you'll be doing that.
Yes. So there are some things we need to do, that we equipment, the setup, and the team. So that is something we'll be working on, and we'll be able to do such interventions.
What are some of the other things that you think that you need to also focus on apart from that, as we go on, as we proceed, as we advance in plastic surgery in Rwanda, that you really believe they're highly needed, but you're not doing it apart from that?
In terms of cosmetic surgery, okay. I feel like,
because let's not forget, we are a country, we have public hospitals, but we know people have their money they want to pay and have the things done on them. So why not provide it for them? Why not have them here?
I think because cosmetic surgery doesn't demand much. That it only demands a skill. It doesn't require much. Just it's not comparable to reconstructive surgery, for example, which will need huge, expensive microscopes, very big team. Cosmetic is easy surgery. It's very easy to do. So it doesn't demand a lot of resources. So we have most of those resources for cosmetic. So I feel like the priority right now is more on developing the reconstructive part, not forgetting the cosmetic, of course. But I think slowly we are getting to the level.
You've talked about having only 6 plastic surgeons in Rwanda. And it kept me thinking, How do you manage to perform all the reconstructive surgeries that are required in the whole country with only 6?
Yeah, of course, there's a limit what someone can do, but we do our best. Of course, there is a lot of patients who wait for so many years. You find someone having to wait for many years to have the surgery, because in a population of 14, if you have 6 people, that's quite a huge demand.
It's quite a huge demand.
That's
And it kept me wondering, really, that how many people you have to perform on to work on a daily shift. I mean, it's enormous. It's quite a big number, and the demand, you cannot afford it.
Yeah, and plus we can't,
Together with cosmetic, also on top of that.
yeah. Plus we don't just do operate, like we are not like carpenters. We are not operating from Monday to Friday. No, so we will have to we have days of operating. We have to see our patients in the hospital. We have to see them in the clinic. We have to educate others, other trainees in plastic surgery. So it's a lot that we do, not just trying to finish up everyone that needs plastic surgery in the country.
Is the trend? I mean, as we conclude our conversation today, unless there's something you think I've forgot that you want really to shed light on, but as we head to our conclusion, do you think really cosmetic is catching up much in Rwanda than maybe 5 years ago?
Yes, so much, because
It's trending everywhere. I was recently looking at a report from it is a story that was done by I don't know, it's a German media house that did a story around the Turkey beauty industry, where they were saying that in Turkey, by the way, if you need a cosmetic surgery in a week, they will make your body, the whole of your body, in the shape you want it in a week. But the consequences are really high. They are really, really high. So as people get to understand that cosmetic surgery is something they can do and seeing it happening in Rwanda, are you also educating, I mean, the general public about the dangers? Because I don't see why we should just give them what they want. But of course, the dangers are going to be back to the population.
We don't do that, because it's our role as practitioners to make sure the general public doesn't fall into prey of what's going on around. So we do things that are realistic. We teach them where we feel like it's not the best, and yeah, we do things that are realistic.
Is there anything that you feel like was deep down on your heart that you wanted to share that I didn't ask about?
And I think we really covered a little bit of everything. Yeah, maybe good that we clarified what plastic surgery is. It's not about only beauty, but beauty is part of it. And even cosmetic surgery it's a right to have if you have the right indication. If you have the right indication, if you see a doctor and it can relieve you something that you don't like, if you can have better results after cosmetic surgery, I don't see why someone shouldn't go for it, as long as it's safe, in the safe hands.
Should we expect you people to also perform the BB butt lifting, these big lifts soon in the country? Or if anyone wants it, you can do it as well?
Really, we cannot say that. We cannot promise that we'll blow someone into whatever they want. Yeah, but we'll always try to meet people's expectations in reality.
So yourself, how many have you worked on the butt lifting and on the breast, if you can recall, breast reduction and butt lifting?
Most of those that I've actually done, because most of the butt lifts I've done them in India.
Oh,
because I trained in India.
okay.
That's where
okay.
And in Rwanda, people I've not seen so many people that want the full butt lift, because in India people go for it, full swing.
butt lift.
Yes. In Rwanda, the ones I've done are mainly who have depressions.
Okay. I
Symmetry,
have this
want
hole
to correct
here.
this, want to correct this. Yeah, so not so many for butt lifts in Rwanda.
Yeah, okay.
Breast, quite a number.